Hello, my name is Cassidy Kennedy, and I wanted to talk to you about PMDD. If you do not know what PMDD is, it is premenstrual dysphoric disorder. It is commonly referred to as a debilitating form of PMS. PMS, the negative symptoms that you experience, that you or someone may experience when they're about to go on their period or they're on their period. Once those symptoms that are normal for most women become debilitating or distracting from everyday life functions, that becomes premenstrual dysphoric disorder. Some of the causes, the research shows that it is related to extreme and chronic stress in early life, and there's a possible role of inflammation with this disorder. Chronic trauma and emotional abuse in childhood has been shown to have a link, but a cause is not specifically identified. We need to do a little more research on what causes PMDD and what effective treatments are. I made a visual aid explaining what happens during PMDD and during the different phases of the cycle, because an important thing about PMDD is it is cyclical. The symptoms have a cyclical presentation because this whole disorder revolves around the period cycle. First phase of the period cycle is menstruation. Commonly, you would think that this is where the PMS symptoms are, but that's sort of a myth. Testosterone is increasing, productivity is increasing, cognition is increasing, and it's known with an increase in mood and productivity. Then you have your follicular and ovulatory phase. Testosterone starts going down. The symptoms during these part of the cycle depend on the person. Everybody's PMDD, if they have it, is different. It can range from, more mild to severe. So during these 2 weeks, you could be more symptomatic or you could be more happy. It just depends on the person. Then this is the PMS monster, the luteal phase. Studies show that cognition can go down in people with premenstrual dysphoric disorder that are in their luteal phase. It means it's harder for their brain to work. They have increased dysphoria and mental and emotional discomfort, physical discomfort, craving fatty foods, and that's where your appetite changes come in. So that's a little bit about what happens during the cycle. The treatment method for PMDD is unfortunately also non-standardized and not adequately researched, but there are a few ways that are commonly used. One example is SSRIs, usually taking sertraline, also using birth control, regulating your hormones, and brain chemicals may help, but the common opinion is that it is not the only way to treat it. You have to treat the mind and the body because it goes hand in hand, especially in this particular disorder. One study shows significant increase in positive effects with symptom onset dosing. Like if you dose your medicine on your luteal phase, and if you're symptomatic during these phases, taking your medicine during these phases, that can really help because, the disorder is cyclical. Unfortunately, the stigma around periods, PMS, can lead to a negative effect on people that struggle with premenstrual dysphoric disorder. We've all heard the phrase, "Are you on your period? Are you sure you're on your period?" To sort of belittle women, and the misogyny in society and the period shame around women's sexual health has sort of created this environment in the society where research and diagnosis may, not be sought after and seen as important. So here is what I would like to talk to you about. This is a call to action. Here's what I want you to do if you are a woman or if you have someone in your life, coworker, partner, family member, sibling that you may know that you want to support that goes through PMS or PMDD. Most people go through it. Self-evaluate. Think, maybe, do I have PMDD? Or do I know somebody that deals with stuff like this? How can I support this person and be aware of what they're going through? That goes hand in hand with education. Spread the knowledge. Help change the culture around premenstrual dysphoric disorder by being aware of what goes on in women's health. Doing this, being aware, would support women, the mental health community, and the chronic illness community. Thank you.